From the Cosgun Lab and the Bioengineering Media Lab at Georgia Tech, welcome to Lab Coat Conversations, where you too can join the discussion on the next academic breakthroughs. Join your host, Hector Torres, as we talk to Georgia Tech researchers. This episode, please welcome Dr. Anant.
So we are here with Dr. Anant. He focuses mostly on cancer immunology, and he works on using AI to address health disparities, especially in finding differences in prostate cancer between Black and white men. And he focuses in the areas of AI, computational pathology, medical image analysis, computer vision, and also focuses on applying these principles to diagnosis, prognosis, and the prediction of treatment response. Is that accurate, would you say?
Yeah, that's a very good summary, Hector. Thank you.
Yeah, for sure. So I guess to start off with, can you give us any specific overviews of how you combine medicine and AI in your work?
Sure. Thank you for that, Hector. Yeah, so my group's interest is on the intersection of artificial intelligence and machine learning and medicine. And this is an area I've been really passionate about and interested in for the last 2 decades now, about 20 years. And our group has been very interested in using the power of AI, machine learning, and also image analysis to really look at routinely acquired data, both digital pathology as well as radiology images, to be able to identify patterns and features and hallmarks from that routinely acquired data that allows for being able to go beyond just the visual assessment or the visual interpretation of the kinds of attributes that human readers, radiologists, pathologists would look for from these routinely acquired data. And what we found over the last 2 decades is we made some interesting discoveries. We've found that there are features and patterns and hallmarks that may not be appreciable by the human eye, but that are very important in terms of disease outcome, in terms of treatment response for a variety of different drugs and agents. For instance, we've looked at chemotherapy, we've looked at immunotherapy. And the interesting thing is that both in radiology as well as in pathology images, we've identified features, we've identified patterns and hallmarks that allow us to go above and beyond what a radiologist or pathologist could do, basically being able to tell us in advance whether somebody is going to respond to chemotherapy, whether somebody is going to respond to immunotherapy. And so that's sort of in a nutshell what our group has been trying to do. And even though initially we'd worked in the area of cancer and oncology, we've really branched out into many other indications, including cardiovascular disease, diabetes, and several other indications.
Yeah, that's great. Have you seen your work have an impact in society as a whole?
I'd like to think so. I am a biomedical engineer, and to me, translation of research is really at the core of why I do what I do, right? And so you can publish all the papers in the world, you can get all the grants, you can get all the patents. But to me, at the end of the day, it's really about moving these technologies to patients. And that's really where the rubber hits the road. That's how you have impact. And so I'm really proud that about 4 years ago, one of the companies that I helped co-found and one of the technologies that they had licensed was actually approved by the FDA for use in patients. It got what is called a 510(k) approval by the FDA. And I know that's just one technology, but it does show that ultimately there is a pathway to take these innovations and ultimately bring them into the clinic. And that's something that we're very focused on. Hector, as you know, we recently launched the Emory Empathetic AI for Health Institute right here in Emory. And one of the things that we are very focused on within the Institute is not just to innovate in the area of AI in medicine, but really to deploy these technologies and ultimately scale and implement these technologies within the clinical workflow. So that's something that we are very committed to, and that's something that we will continue to work on.
Yeah, of course. And not only did you launch the Emory AI Health, but you're also leading it, right? So do you have any projects that are coming up in the works?
Yeah, Hector, I think there's a lot. It's obviously early days yet. We've only launched it about about a month ago, and we a big part of it initially is recruitment and community building. So that's something that we're very focused on. But I would say that in terms of big picture, the institute is going to focus on some of the really challenging, some of the big problems that we face in healthcare and medicine today, not just in the United States, but really on a global basis. Problems in the US that we have around financial toxicity, for instance. We know that there are many cancer patients who end up being exposed to very expensive drugs that may not work for them, and that actually results in significant financial loss and financial hardship to them. So that is certainly a major concern. And that's one of the things that we're looking to address by use of these technologies like AI, where we can tell in advance whether somebody's going to respond or somebody's not going to respond, and therefore potentially help alleviate this issue of financial toxicity. A second issue is around the topic of health disparity. Health disparity is another big issue here in the United States, where we see that there is significant um, uh, difference in mortality and outcomes between populations of color, for instance, and other populations. And I think that's where AI can also play a role, where we can think about developing more tailored, more personalized prediction models for populations of color. And then really thinking about from a global health perspective. I myself am an immigrant. I grew up in India,
Hmm.
and I think a lot about impacting health and bringing precision medicine, affordable precision medicine, to low middle income countries like India. And I think that's where AI could be the great leveler, right? It could be the technology that helps really move these kinds of technologies and really impact and operationalize precision medicine, but in an affordable manner in the global context and in low middle income countries.
Hmm. So some people actually have concerns when it comes to merging AI and medicine. Do you have anything to sort of like quiet down these qualms, I guess?
Yeah, so Hector, you're absolutely right. There are a lot of concerns, and I spend a lot of time trying to think about what these concerns are and why are there concerns. And what I have come to the conclusion, and of course, this is my opinion, so take it for what it is. But I think that at least one of the concerns has to do with transparency, right? And the transparency issue is then linked to the issue of equity, right? So let's dive into that a little bit. Now, one of the challenges with a lot of AI right now is that it's very black box. It's very opaque. We don't understand how the AI is arriving at its prediction, at its conclusion. And the concern here is that the lack of interpretability of the AI means that it might be introducing implicit bias towards certain populations, right? Which is very valid. For instance, if you don't understand exactly why the AI is arriving at its particular prediction, then that AI might end up making predictions that disadvantage populations of color, as an example, because it's maybe trained on a population that was not inclusive, right? So one of the key things that we're working on within the institute is really towards more interpretable, transparent, explainable AI from the get-go. In other words, trying to find features or patterns in the data that we can directly model and that require understanding the pathobiology of the domain more intentionally, more substantially. But it also, it requires more work, but it gets us away from this black box opacity that is unfortunately how a lot of these AI models work. And then the second piece that I think is a big concern is this other issue of ethics and bias. A lot of the tools that unfortunately are out there simply don't work in populations of color, and we have to do better. We have to make sure that the AI tools are inclusive, that they are trained in a way that accommodate multiple different populations of color. And we can't have a situation where these tools are only working in one population, but really disadvantage other populations. So I think that we have to be very, very crystal clear about this and make sure that we are very intentional about how we develop, deploy, and validate these tools so that we
Yeah,
can drive trust in these models. Yeah.
yeah, absolutely. So as we wrap up here, just two final last questions, but what would you say to students looking to enter AI and medicine as as part of their future goals?
So, to me, the ultimate proof of the pudding here is developing equitable AI tools that are going to allow for um, adoption and consumption by physicians, by end users, by patients. That's, I think, really the ultimate goal of the kind of work and the kind of technologies that we're going to be developing. One of the key things that we're going to be doing is really working very closely with clinicians and physicians. And one of the things that we've seen in the past is when these AI technologies are developed in a vacuum, then it results in these more black box, opaque kind of models. So when you have multidisciplinary interactions with physicians, then you have an opportunity to really develop tools that from the get-go are more interpretable, that are more transparent. One of the things that I'm very privileged about here at Emory and Georgia Tech is the fact that my students are able to engage with physicians, with clinicians. And one of the things that I really impress on my students is that it's not enough for you to just be experts in AI or experts in machine learning, but really to be able to um, develop technologies that where you really understand the pathobiology of the domain, where you're really understanding, how this particular technology is going to have an impact for a particular disease like breast cancer. You can't just be an expert in transformers. You have to understand breast cancer, and you have to understand breast pathology or breast imaging, depending on the problem that you're looking at. And that means you need to be working and talking to breast pathologists, talking to breast radiologists. So my 2 cents for students or trainees who are looking to enter this field is, you have to be multilingual. It's not just enough to be an expert in AI or machine learning. You have to learn multilinguality. You have to learn the nuances of the domain that you're working on, and you have to make sure that you're really seamlessly converging both the disciplines, the technical discipline, but also the biology, and bring that together. So you've got a holistic understanding, a synergistic but holistic understanding of the domain and how the technology that you're developing is going to make an impact in that particular domain.
Yeah, for sure. So we're wrapping up. Where can people find you if they have any more questions?
I'm right here. I'm on social media. I'm on X. I'm on LinkedIn. I think I'm reasonably easily searchable, and I get a lot of emails. I get a lot of incoming. I try to respond to the best I can. If I don't respond, please be persistent. Please continue to send emails, and I will at some point get back to you. I try to be as responsive as I can, but sometimes it's very difficult to be always prompt. But I will, at the very least, at least direct you to folks perhaps within my group who can respond and connect with you. But yeah, please, if you don't respond, please don't give up. Please be persistent. If you're really passionate about this area, we're always looking for passionate individuals to join our group. But even if you don't join our group, we're happy to share our knowledge, our expertise, and help you forge a career in this space.
Yeah, absolutely. Well, thank you so much for taking your time out of your day to come talk with us.
Absolutely.